GM unwittingly funded Ralph Nader's consumer advocacy movement. In 1965, Nader published Unsafe at Any Speed, a study that revealed that many American autos were unsafe, particularly GM's Chevrolet Corvair. GM reportedly sought to discredit Nader. Nader fought back and sued GM for invasion of privacy. The case was settled for about $284,000, which Nader used to found the consumer movement. And now, 4.5 decades later, GM has filed for bankruptcy, and Nader is taking the side of its shareholders and bondholders. Why? Ralph Nader, consumer advocate and former presidential candidate, joins us now from Washington. Mr. Nader, welcome to Bloomberg News.
Thank you, Mark.
Sir, why are you taking the side of the shareholders? Isn't risk part of the game here when you are investing?
Well, it's not just shareholders or bondholders. It's communities, it's workers, and it's consumers and dealers. Basically, I oppose this dictatorial bankruptcy court. It operates under very tyrannical moves where the judge is basically a rubber stamp approving one request after another by management, in this case GM. And so GM emerges in a new clean GM, no liabilities, all assets, leaving behind an old GM full of liabilities,
right,
and shearing off dealers and people who are driving cars who can be in accidents due to defective cars. They're wiped out. Their legal claims against GM that are in the middle of a trial,
right,
will be wiped out by people who are paraplegic or otherwise injured because of defective cars.
Well,
and then the cancellation of dealers, right, is unconscionable. Dealers don't cost GM anything. Essentially,
what's Ralph Nader's plan? What's your plan? If not what's going on now, how would you change this?
We have to have a congressional deliberation, very thorough. This should have happened before the bankruptcy, of course. Just the way Congress deliberated in 1979 on the bailout of Chrysler. They had hearings, they had reports, they had legislation. Just the way Congress restructured a complex railroad situation when Penn Central was a basket case even worse than GM in the 1970s and came out with the Conrail legislation. In this case, Mark, Congress washed its hands of all responsibility. Sent it to Obama. Obama put it in a secret task force, auto task force, run by Wall Streeters, and this is what you have. Wreckage all over the country, and they're going to keep GM management.
Right. Well,
except, that was stated by GM a week ago.
Mr. Nader, you know what the administration has been saying. They've been saying that swift action was needed. If this had gone through the type of congressional oversight that you're talking of, would that have bogged down the process and made a bad situation even worse?
It didn't with Conrail or with Chrysler. They should have started early this year after the preliminary skirmishes in the congressional hearings last year over corporate jets transporting executives to Washington. The Congress should have gone down to work. Congress is an ink blot. It abdicates its responsibilities in one major area after another. It doesn't want responsibility. It sends it to the White House. That is not what the Constitution was framed to do.
Who, in your opinion, should be running GM now?
People who know auto production, who know auto innovation. There are a lot of them in the auto supply area. A lot of them were pushed out of the auto companies by incompetent management year after year that produced this mess and ended up with this kind of debacle. GM last year had revenues of about $150 billion. That should be enough in a well-managed company to make it run in the black instead of in bankruptcy. And the big question is, Mark, are all the lucrative China assets of GM in China, are they going to be part of the bankruptcy? We're all waiting for GM's declaration of assets to see what they're going to leave out, right, and squeeze the creditors and the dealers and the suppliers and, above all, the injured people who are in the middle of litigation against GM and are eliminated from their day in court. You can't get anything crueler than that.
Mr. Nader, you have heard this phrase during this economic downturn of too big to fail. The administration had made it clear that allowing the auto industry, the American auto industry, to fail was not an option. Was that the right move?
No. As a community banker in Indiana put it recently, if you're too big to fail, you shouldn't be that big. That's another way of saying the antitrust laws should prohibit that. Otherwise, when you're too big to fail as a corporation, you transfer your risks on the back of taxpayers and knock out all the common shareholders. Isn't it amazing, Mark? The common shareholders own GM. They're not consulted by their hired hands in executive suite that wants to dissolve the company. I mean, it's a farce. It's a mockery of capitalist principles. These shareholders, including mutual funds, pension funds, individual shareholders, they're not gamblers. They were told this was a blue-chip stock years ago. You know, buy it and put it away. Hold on to it. And they don't even have a consulting role, right. Never mind a decisive role. That's where we are now.
What's the new GM going to look like, say, a year from now?
Well, the new GM will shear off all its responsibilities, have a clean sheet, and it will increasingly move to China. The grand strategy of GM over the last 10 years has been the following. The American market is stagnant and declining. They can't handle Toyota and Honda. The Chinese market is gargantuan, and it's a platform to build cars over there with serf labor and re-import them back into the United States. So that's what's going to happen. That's why GM management, once they got rid of Rick Wagner as CEO, who didn't like the bankruptcy option, now they see, okay, it's bankruptcy, we'll be out of it and under this rubber stamp judge, and we'll move gradually to China. And that's what we're going to see. Right. No allegiance to the United States where GM was born, no loyalty to the workers, no respect for the taxpayers. Right. They're out of here. That's why we have to reconsider the difference between corporatist dictates and capitalist principles that are being ground under. And consumer advocate Ralph Nader has been gracious enough to agree to stay with us through the break. We'll come back and we're going to be talking about health care. Stay with us. Bloomberg News continues in a moment. Right now, we are rejoined once again by consumer advocate Ralph Nader, who is in our Washington bureau. Mr. Nader, thanks for staying through the break. On health care, the Senate may release its draft legislation by June 17th. What of this debate of public-private programs? Where do you fall? I'm for a single payer, which is supported by a majority of the American people, a majority of doctors and nurses in recent polls. Basically, it's full government health insurance and private delivery of health care with free choice of doctor and hospital, which tens of millions of Americans don't have in HMOs today. And they focus on drastically reducing administrative costs, maybe $350 billion that now is absorbed by the Aetnas and other insurance companies with their hierarchies and their determination to impose systems riddled by exclusions, deductions, co-payments, and pre-existing conditions. Well, Mr. Nader, we're reporting that Harlem Congressman Charlie Rangel, the chair of the House Ways and Means Committee, is saying that a House plan would also include cuts to Medicare and Medicaid. Well, we don't know the details yet. We do know there is a growing movement around the country. In fact, all these meetings that Obama's people are holding around the country on health care, it's dominated by people who are demanding single payer, otherwise known as full Medicare for everybody. Everybody in, nobody out. Now, there are 79 members of the House who've signed on to single payer, H.R. 676, led by John Conyers. They are not consequential because Nancy Pelosi and Senator Reid, the Democratic heads of the House and Senate, have declared it off the table. But it's going to come back. It's either sooner or later. You can't have such a wasteful, inefficient system where millions of people, after 50 years after President Truman proposed universal health care and didn't get it, you can't have 50 million people uncovered, all this waste, all this wrangling the bills and collections. One of the reasons why a majority of physicians and nurses want single payer, Mark, is because they want to practice medicine and nursing instead of bill collecting and have their hands tied by clerks of Aetna and other corporations who tell them what they can and can't do. Well, the chairman of the Senate Finance Committee, Montana Democrat Max Baucus, is saying that a compromise solution may be creating a health care cooperative. Would that work? I don't know exactly what he means by that, but I know Senator Baucus is against what's called a strong public option, giving people, in effect, a Medicare option if they don't want to buy it from the health insurance companies. He seems to be against a weak public option. He's got this cooperative idea And, of course, Senator Kennedy and his backers want a strong public option, so they're going to clash in the Senate, which makes it less likely, unless they can figure out a modus vivendi, less likely they're going to ever get this bill through before the August research. There's also a big conflict brewing, Mark, about will Congress tax health care benefits? So you get taxed on your health insurance as if it's income,
right?
Depending on how much your package is, not entirely in the lower packages. Now, that is so absurd that I have to say to your viewers the following: if our country is spending, as it is, $7,600 per capita on health care with 50 million people without health care insurance, double that of Switzerland, Canada, Germany, which spend under $4,000 per capita and cover everybody, then we've already spent what is needed to cover everybody by shifting away from the disparity costs, from the administrative costs, from the billing fraud that has been documented by the Government Accounting Office. So the key is this: if they're going to tax anything to pay for health care, for heaven's sake, tax speculative derivatives on Wall Street, which are not taxed at all.
Mr. Nader, we have about a minute left, and I want to ask you about something that you have been watching since you've been in the public arena, the new tobacco legislation, the FDA and its ability to regulate nicotine as an addictive drug. What were your thoughts on that following the Senate action yesterday and the action that's pending in the House?
Well, that's a compromise bill, but it's something none of us ever dreamed would occur when we started fighting the tobacco industry. It has good disclosure. It has good research built into it. But it doesn't really tackle the nicotine problem enough. It can declare certain levels, but unless you deal with the nicotine problem, you're not going to deal with the tobacco problem.
And I should mention, I should correct myself, that did pass the House and it's going to the President's desk. Consumer advocate Ralph Nader joining us from our bureau in Washington. Mr. Nader, it's a pleasure. Thank you very much.
And thank you, Mark. Thank you, viewers.